Well, drugs and alcohol abuse continue to be serious problems in our society today, and this goes for both young and older people in our community. And Dr. Stephen Lopez is here from Palmetto Lowcountry Behavioral Health to give us just a little bit more insight on what we're talking about. It's good to have you with us.
Yeah, thank you, ma'am.
So the first question I had, and we were just talking about this, but it gets kind of uncomfortable sometimes when you have to have that conversation with someone. How do you bring it up without them getting confrontational with you and you seeming like you're accusing them of abusing drugs or alcohol?
I would say it falls in two different categories. One, if it's a family member, I always tell families, especially with adolescents and young adults,
Yeah.
you got to be straightforward. I mean, if you have a real relationship with these people, then you should be able to be confrontive and not feel like you should tiptoe around the issues. Because worst case scenario is if you don't, something bad happens,
then it's worse.
there might not be somebody around to talk to about it. So I would always recommend being very sincere with them, saying we do have concerns, and we are seeing this. If we're wrong, I apologize, but if we're not wrong, what can we do to help out? So I think I always believe you should be very confrontive.
But and also asking them what can we do to help instead of just saying, well, you need to go get help.
Yeah, well, support
what can
it.
I do to help?
You want to be supportive. I mean, especially with families. It's an addiction. You can't do it by yourself. You got to have family. You got to have that kind of support. Friends, church, school, professional help. A lot of these drugs will bring forward deadly withdrawal symptoms. At least extremely uncomfortable. At worst, death. So you got to get help. You got to get support. You can't do it by yourself.
I imagine it would be a little bit, and I don't know this for sure, but maybe it's a different approach when you talk about teens, whereas you're also talking about senior citizens, because especially if they're your teens, then you're their parent. But you know, if it's your parent that you're trying to talk to and you're like 30 years old, they might look at you and say, well, you know, what are you saying to me? You know, how do you know what's best for me? And I'm your parent.
Well, it's tough with, obviously the older generations is getting bigger, people living longer. They're set in their ways to a certain extent. So yeah, it can be very challenging as a son to confront your parent, because you've lived your life with your parents confronting you with stuff. Now you got to flip it around, but it has to be done. Geriatric patients are using alcohol and prescription drugs. They're sicker physically. They're on pain medications. They start abusing the pain medications, start using alcohol to deal with stress of losing friendships, losing spouses. It's tough, but it's definitely gotten more of an issue.
Yeah, doctor, I wouldn't even know though where to start. So is that where you all come in? Maybe if I do feel like there's a family member that does have an issue or a friend that has an issue, can I just give you all a call and maybe you can give me some guidance if I'm just completely lost as to what I should say? Absolutely.
Our phones ring all day long with this exact same kind of questions. We always tell families to bring their loved ones in, or loved ones who come in, who call us directly, come on in, we'll do an assessment for free. And then we can decide, you know, whether to refer them to an outpatient program, to inpatient if they're at risk of deadly withdrawal symptom. So yeah, we definitely guide in that direction.
Some people are able to just say to themselves, okay, it is me and it is my problem. I need to go get help.
Yes.
For a person that's trying to do that, that could be a very scary situation. What do you recommend, especially if it's someone that's, maybe they have a really high position in the community or people look up to them? It might be hard for them to say, I got an issue and I got to disappear for a while.
It's really hard. I mean, one thing that we have on our side is confidentiality. Anybody comes to our facility or any medical facility, confidentiality rules are huge. Like, we cannot talk about it to anybody else. It's very quiet, and they get the help that they need. But you know, admitting the problem is the hardest thing.
Right.
And then getting the help is the next step. That's something that we do at our facility, that you can go to other facilities, do the same thing. Start with an outpatient provider and they have a primary care physician. Call them as well. You know, it's many different ways to get help, but you got to ask.
But Dr. Lopez, what I also like about your facility is that you're giving people help, but at the same time you're doing it without judgment. And a lot of people, they'll come to you and they'll say, I don't need you to tell me that I'm wrong. I need you to just help me.
Yeah, we see people on a daily basis who are having the worst day of their lives. So judging is not going to be very helpful, and we're there to help 100%, because we know that we can give positive outcomes.
Yeah. Well, tell us once again where you're located and a phone number we can reach you at.
Located at 2777 Spice Seeger Drive. Phone number is 843-747-5830.
Wonderful. Well, thank you so very much for being with us. We really do appreciate it. Valuable information that everyone can use.
All right. Thank you, ma'am.
All right, on over to Dave.